Now that DNI, Tulsi Gabbard, has released all of those classified documents, we're actually seeing who was behind all of this. Do you want to see indictments?
JD Vance putting in phenomenal work as VP. And let's be honest here, folks. No jail time means no accountability. We want justice now.
Meanwhile, we're still waiting for accountability on the whole Russia collusion made-up story.
Yes.
Now that DNI, Tulsi Gabbard, has released all of those classified documents, we're actually seeing who was behind all of this. Do you want to see indictments?
I absolutely want to see indictments, Maria. Look, of course, you got to have the law follow the facts here. You don't just indict people to indict people. You indict people because they broke the law. But if you look at what Tulsi and Kash Patel have revealed in the last couple of weeks, I don't know how anybody can look at that and say that there wasn't aggressive violations of the law. What they basically did is they defrauded the American people in order to take Hillary Clinton's presidential campaign talking points and turn them into intelligence by defrauding the American people, defrauding the intelligence agencies, lying about what the intel said. They would take something that supported a Hillary Clinton campaign talking point and they would overemphasize it and exaggerate it. They took anything that actually contradicted that narrative and they buried it deep. And through that, they actually laundered Hillary Clinton's presidential campaign talking points through the American intelligence services. That's a violation of the people's trust. That's a violation of what our intelligence services should be doing. And I absolutely think they broke the law. And you're going to see a lot of people get indicted for that. Here's the thing that should really bother the American people.
And this should really bother the American people. This is an alert that I just received moments ago. And the latest information on Medicare Part B deductibles for 2025 indicates that the annual deductible for all Medicare Part B beneficiaries will increase to $257, up from the 2024 number. This increase, announced by the Centers for Medicare and Medicaid Services, CMS, is $17 more than the $240 that was before. And this is attributed to projected price increases or changes and assumed utilization increases consistent with historical trends, okay? This is inflation, basically. And for 2026, projections from the 2025 Social Security and Medicare Trustees report suggest the Part B deductible could rise further, even more so, to $288. That's a $31 increase, over 11% more from 2025. This estimate is subject to change as final amounts for 2026 will be confirmed in the fall of 2025, which is right around the corner in the autumn. The projected increase aligns with expected rises in healthcare costs and utilization. These changes affect all Medicare Part B enrollees from the information that I have been provided, and whether in original Medicare or Medicare Advantage plans, as the deductible applies before coverage kicks in for outpatient services like doctor visits and medical equipment. Most beneficiaries will see the standard monthly Part B premium, which is also rising to $185, up over $10, deducted from their Social Security checks. So, how many of you are on Social Security? How many of you are not interested in seeing this increased amount deducted from your checks? If you're planning for these costs, consider reviewing your coverage options during the Medicare open enrollment period, and consider reviewing these options and these costs now. The open enrollment period is October 15 through December 7, but the early bird catches the worm. To explore plans that might offset out-of-pocket expenses, such as Medicare Advantage or Medigap policies, I recommend you call our friends at Chapter. And if you are interested in saving money, specifically on your Medicare, then make sure you give our friends at Chapter a call. And I want you guys to really, really pay attention here, because it's come to my attention that most seniors are not on the best Medicare plan. They're either overpaying for the same coverage they could get elsewhere, or they don't have the coverage they need in an emergency. Chapter can review your options in under 20 minutes. It's fast, it's simple, it's easy, and it's free. If you're already on the best possible plan, they'll tell you they're unbiased and they're purely here to help folks, seniors, save money on healthcare, on average $1,100. And If you're not on the right plan, they'll help you switch, even if it's to a plan that pays them nothing. Again, unbiased, folks. This is unique and unlike any other Medicare provider out there. And this is exactly why we love Chapter so much, because they're literally just trying to help people. Chapter works for you, not big insurance or the government. And there's no pressure, just honest, free advice from professionals who know Medicare inside and out.
What do you want our intelligence community to be doing? I want them to be catching bad guys. I want them to be making sure that terrorists aren't going to kill innocent American civilians. I don't want them laundering Hillary Clinton's campaign talking points into the American media and giving them this air of legitimacy. It is sick. And it's disgusting. It hurt the intelligence community, it hurt the American people, and it hurt the first Trump administration. We've got to have consequences for it, or we're just going to see the same play repeated again and after again.